Through this Giving Tuesday grant, there are two primary activities. This footage captures an in-service for providers, and providers being mental health professionals of varying disciplines, as well as some caseworkers who were interested in refugee mental health in general, but also in dance movement therapy, and dance movement therapy more specifically with our refugee community. Most mental health training programs, most programs, whether they're psychology, social work, counseling, the creative arts therapies, have not historically offered classes in trauma. I think that's changing, and I think there's also more information about what neuroscience, neuroscience is really the field that is now promoting and endorsing the use of body-based and creative arts therapies with trauma. So I think both of those are getting more airtime or coverage in training programs, but for the most part, many providers went through their training without the benefit of either a trauma class, and certainly without the benefit of a class that focuses on working with war trauma, working with people who are displaced. Most people who are arriving because they're displaced, arriving to the United States as refugees, but also as asylum seekers, come from more sociocentric cultures, which are cultures where the sense of self is defined more broadly than the very individualistic, I end at the skin on my body. For many of those cultures and contexts, how people understand something that we would call a traumatic experience, how they understand it, and also how they might work with it or heal it or celebrate it is often done more socially. So it's done in community, it's done in ritual, it's done with drumming and dancing, it might be done in art or with poetry. It's rarely to the individual mental health provider that many of the people coming from the particular countries and cultures that are being affected by war and violence right now, it's rare that mental health or going to a therapist is what they would do back home for healing or restoration. I like to define dance movement therapy as the marriage of psychology, the best of psychology, and the best of dance and movement. Movement is a universal language. So no matter where we're from, we move initially. We express and communicate and respond through movement. There's a real universality to moving together. I also like to say that every movement begins with a breath, and every action, every life action, everything that we do in our life begins with movement. Dance movement therapy, while being very powerful and I think culturally relevant and universally relevant for working with refugees or those coming to the United States or anywhere else as immigrants, it also has to be adjusted. By nature, any creative arts therapy has a very expressive component. Working with dance movement therapy, the way that I've adjusted it over 20 years of working with refugees and survivors of torture is to titrate it, to really boil it down to breath and movement, and then dance. Sort of like breath is the roots and movement is the trunk of the tree, and dance might be the leaves and the flowers. They might bloom or they might not in a session, but that's the potential for where we can go. I'd like to thank the American Dance Therapy Association and the Marian Chace Foundation for this Giving Tuesday grant, which offered our refugee community the opportunity to experience dance movement therapy, and also provided two in-services, one for refugees and one for providers who will or are working with our refugee community.